Corewell Health Lakeland Hospitals is composed of 3 hospitals, around 50 ambulatory centers. We're continuing to grow, and almost 400 licensed beds. When we think about our goals for the hospital, it comes down to people. People are first. And one of the areas of our biggest focus of our mission is to bring in innovation and autonomy into the workplace. Bringing meaning to the work that people do every day is part of the culture that we've created here.
When I first heard about RQI at a conference, I was so impressed with it, and delving into it even deeper to find out that it was the gold standard around how we do our BLS training for our team members and making sure that they have what they need to do the job when the job needs to be done. That was a big piece of the why. When we've had team members have 2 years between doing their certification, it was difficult for them if they didn't have a code to actually practice on, to feel comfortable when a code did happen on their unit, and having the quarterly option really increased the ability for them to feel comfortable.
I was tasked with bringing RQI into our system, and with the gold standard it's all evidence-based. And so with evidence-based, it's proof that with doing your CPR quarterly, it improves skills and we have better outcomes.
So it made sense for us to make the change because it was an investment in our team members and what our team members wanted us to do.
We worked together pre-implementation to get the program approved at Corewell Health. During the implementation phase to identify any administrative challenges and put together the plan for the launch, and then post-implementation in a continuous success model to work collaboratively to troubleshoot together, share best practice, and focus on data analytics and real-time feedback with the team.
It's been a really easy process to implement. The mannequin and the cart that you practice on is always in a convenient location. So really I'm only taking maybe 15 minutes out of my day to do that. And it also makes me feel great knowing that my team, everyone else in the clinic, is also getting their skills checked every quarter.
With this RQI, we don't have to take time out for classes. We can do it on the job versus you have to take a class that can run anywhere from 2 to 4 hours. They're able to jump on at any given time. They can even get on the mannequin and practice CPR anytime they want. And I'm seeing that increase better outcomes.
So we brought the concept of RQI to our shared governance councils because we value the input of our nurses here in our organization. And we have shared governance councils that look at all practices that the nurses have. And so when we brought RQI to the practice councils, we were able to share what the program was all about. They were very excited to hear that they could take ownership of their own training on their own time, 24/7 accessibility. By implementing this program here in our organization and providing the frequent skills, knowing that skills have a gap degradation after 3 months, we are having people better prepared when they're at their child's baseball game, when they are at the grocery store, when they are at a shopping center.
I feel much more confident if an emergency situation were to arise. I know that I've got the skills to step up and take action.
Being able to practice my skills and take those the quarterly assessments, it actually has helped me remember my ratios and my ventilations much more easily rather than having to flip back through my brain. There's much more, okay, I see my due date on the board, make sure I get it done, and it seems like people have been keeping up on their skills rather than getting behind and forgetting the every 2-year class.
And for me, as a leader for this program, it makes me feel really good when I run to codes and I watch them doing compressions and I'm watching their confidence build and I'm seeing that they're able to switch when they're supposed to switch and know exactly what to do.
Corewell team is an amazing team. They're exceptional. In every way. Their dedication has been very apparent from the very beginning.
The impact manager, Ashton, that I started the program with, she always was there when I needed her. I would send an email, a text, and we would troubleshoot. The best thing about RQI that I feel is that our staff is more prepared.
The team is just really passionate. I mean, this is something that our clinical educators and nursing leaders championed for a couple of years. This is something that they talked about for a long time and envisioning bringing this into the Lakeland hospitals and into the community. And once they received the green light, they were unstoppable. So having something where every quarter you're checking in on your skills is just extremely important, and it's confidence building for the team member and then also for the patient. And you can go into a critical situation and be more confident in your skills and the team members that you're doing it with.